Welcome, everybody. Hello. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I partnered with them to bring you an easy and educational workday session. Today's session is injury prevention for golfers, strengthening and stretching techniques. We're going to talk about what makes good golfers move well, what makes their swing efficient, and what are the hallmarks or the landmarks or the tests that you need to be able to pass to swing a golf club without injuring yourself. A little bit about me. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've been a physical therapist, I guess, since 2000. And for the past 12 years, I've been helping amateur and professional level golfers move better, feel better, and play better. I'm also an orthopedic clinical specialist, a certified dry needling specialist, and certified golf medical professional from the Titleist Performance Institute. So a lot of these things that we're going to be talking about today have been tested and researched by the Titleist Performance Institute. And this is stuff that they do for all their professionals that come in and get tested at their headquarters in Oceanside, California. All right. So without further ado, let's pull up this little slide here. There it is, right there. Okay. Now, injury prevention for golfers. All right. Again, like I said before, if you have any questions, feel free to use the chat. Let's get into it. So the stuff that we're going to be talking about is geared at a broad population. All right. A broad population. So the information that we're going to go over is useful, but don't consider it medical advice or physical therapy advice. All right. So if you're dealing with something specific, please go get a thorough physical examination so that you can address the root causes of all the issues that might be connected to your problem. Alrighty? And as we're going through these exercises and stretches, make sure that you don't push through pain. Pain should never be part of any exercise or stretching experience. It should always feel like maybe there's like a little bit of a pull, but never sharp or stabby. And if you get out of the stretch, if you move out of that position that's uncomfortable, that symptom or whatever that sensation should abate. It should go away and should never feel worse afterwards, right? So my rule of thumb is, physical therapy, exercise, there should never be pain involved. A lot of times people will think that physical therapy is, PT is about pain and torture. It's not, all right? It's about improving the way that you move and how you fulfill your role in society, whether it be a parent, a father, a mother, daughter, whatever, or an athlete, without causing undue stress or pain to your body. All right. So another thing I like to talk about, especially with all my golfers, is that, we used to say that, and this has changed in the past couple of years. A lot of the knowledge has been disseminated to the public but we used to say that, most golfers, they get hurt. But just like other athletes, if other athletes get hurt, we never say that they should never be in the gym, they should never be working out. But we do oftentimes say that about golfers, that, oh, they're working out too hard, or they're doing stuff that might cause pain. So, but just like for golf, we're talking about everyday life and function, right? And we want to be able to move and be efficient, be healthy. All right. So if you've been to any of my classes before, any of my talks, you probably have seen this video. This is basically how the body functions. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. So if you're looking at this diagram here, this alternating pattern, for golfers, it's all about mobility, being able to rotate. And the big key parts that we want golfers to rotate from are the hips and the T-spine, the thoracic spine. All right, so that's the mid-back and the hips. Now, the thing that's sandwiched in between those parts are the lower back. Now, I've treated hundreds of golfers in the past, 10 years, and then one of the most common complaints is low back pain in golfers who swing. Specifically, if you're a right-handed golfer, it's usually the right lower back that hurts after a round. It might be the day after or whatever. If you're trying to play, 36 holes in one day, it might be like the second round or things fall apart. But anyway, most of the time, low back pain comes on because the role of the back is supposed to be a stable segment. That's supposed to be solid. The lower back doesn't like to rotate. It's not designed for rotating. It's designed for flexion, like forward and backward flexion extension, and side bending, lateral flexion. But rotation comes from the thoracic spine and the hips. So oftentimes, if we're tight or limited with the mobility of the hips or the thoracic spine, our body compensates and makes the lower back unstable or mobile. All right. So it reverses its role. If we have a tight hip, that's considered like a stable segment. Then the lower back reverses its role, becomes mobile or unstable. So when you're getting yourself checked out, or if you have some issues, either an ache or pain or something that happens in a joint, make sure that you look above and below so that each of these segments is doing what it's supposed to do. Like, for example, knee pain. If you have knee pain, we want to look at the foot, the hip, making sure that both of those parts are doing their roles properly. If not, you might be, might have pain in the knee. All right. So everybody that comes in to see me, we do a physical screen, a physical assessment. And for golfers, there's a couple things that we need to make sure. Like I said, thoracic mobility and hip mobility. But not only do we have to have good range of motion or flexibility, but we also have to have good control. And one of the tests that I do, let me pull this up, is called the pelvic rotation test. And I'm going to pull this up so big screen so you can see this. So basically, this is a test that we look at how a golfer can rotate their pelvis. One of the hallmarks of good ball strikers is the ability to dissociate lower body and upper body. That means that you can move one part of the body and not the other, okay? And do it with good control and range of motion. Now, this is what a good pelvic test is supposed to be made up of, but then you have these faults. These are common faults that I see with pelvic rotation tests. We get a lot of upper body movements or lateral motion from the lower body, because people will think that when they rotate, it's about getting from left to right side, and that's more lateral. You want to be able to rotate. And then here's an example of a tour pro, Charlie Hoffman, in the before and after test, right? Let me pull that back up, sorry. Before and after test. This is his pelvic rotation test on the left before, and then after a couple exercises and drills, that's what the second part looks like. All right, so let's kind of take a look at this. Let's break this down. I've got my two shot here. Hopefully you can kind of see me in this camera. All right, so what you're going to do this and assess yourself is that you're going to have a buddy or have a mirror and get yourself into golf posture, right? Think about like a 5-iron posture, and then put your hands across your chest. Now, keeping your hands across your chest, we want to see, can we keep the torso still and then rotate the pelvis? Now, a lot of times the faults that we'll see, is easiest to see from the back, is that when they keep the upper body still, they'll do this side to side motion. And that often comes from the feeling or the movement coming from the legs. When they think about, oh, I need to get from my right side to my left side, or trail side to fore side, or front side. So they'll do a lot of this and like, oh, this is how I move my pelvis. Lateral flexion versus rotation. Rotation should occur from the abdominals to control the transverse and external and internal obliques, being able to stabilize one segment, torso not moving, and then the pelvis rotating. All right, so that comes from the abdominals and not from the legs, like where most times people will start to push and pull. All right, so let's kind of bring that back up. And then the other test, the other hallmark that I take people through is to measure their thoracic mobility. How much can they rotate? And this is the seated trunk rotation test. All right, let me pull that up so you can kind of get a better look at this. Basically, you're going to be sitting in a chair, keeping your knees and feet together. And we want to keep your knees as still as possible. And you have a club or a stick behind the shoulders. And we keeping the lower body stable, the legs stable. You're going to rotate. Passing would be 45 degrees. all right? So we want to be able to rotate. So this is just purely quantitative versus the pelvic rotation test was more qualitative, all right? And I'll show you a picture here of Billy Horschel. This is Billy Horschel at TPI doing the the thoracic rotation test, and you can see here it's like past 45 degrees. So tour pros, the average is like 60 degrees, all right? So to kind of set this up, I'll have a PVC pipe for most people, and then I have them sit down, and you get your feet and knees at 90 degrees, keep your feet and knees together. The stick or club or whatever goes behind the shoulders, kind of keeping your chest open, right? So this locks up the scapula, the shoulder blades. A lot of times people will try and test it with the arms in front or the club across the front. Basically that frees up the shoulder blade to kind of compensate for limited mobility through the thoracic spine. So they just kind of move the shoulder and say, oh yeah, I've got all this degree of turn. So when you're here, you're basically going to keep an eye on your feet and then rotate, or keep an eye on your knees and rotate as far as you can. And it's easy if you're sitting, say, at a chair. Let's see if we can line this up. And if I'm sitting at a 45-degree angle from the edge of the chair, the back part of the chair, this edge is going to be about 45 degrees off center, right? So that's one way to kind of do this on your own. So you're going to sit, feet and knees together. You're going to keep an eye on your knees. You cannot move your knees with this. You get the stick or club behind your back, and then keep an eye on your knees, and you rotate as far as you can. Now, if the knees move, that's a fail. A lot of times people will start to do this, and then the knees separate, or the knees, one knee moves forward, one knee's back, and like, yo, look at me, I could rotate as much as I can. But anyway, you want to keep your eyes on that, keep that locked in, and then have that control and that mobility to at least clear 45 degrees. So if you're looking here, the stick is like in line with this edge of the chair, okay? So that's what we want to do, be able to rotate at least 45 degrees in the thoracic spine. All right, so let's pull up the slides here. So those are our two tests. Now, my philosophy is whenever we're addressing these issues and how to avoid injuries, one, we have to move well, and two, we have to be consistent with our ability to move well. But also there's this hierarchy, right? We need to be able to build a solid base. So in order for us to play a sport or express skill at its highest level at the top of the pyramid, we want to be able to have good range of motion, joint mobility, the tissue extensibility and flexibility. Those are two different things. They might sound the same, but we want to make sure that muscles can lengthen and shorten, and also tissue surfaces can slide on one another and muscles can turn off and turn on so that you can express that flexibility. And also you want to have strength and stability, meaning strength, can you just lift a weight? You know, how strong is a muscle? But also, can you stabilize one part and then move another part? That dissociation, that stability, balance, whatever. And then once you have all those components, and we work on speed and power. Can you express all that range of motion, that power, that speed in a quick fashion? Because again, it's like less than a second, and that downswing sequence happens 0.7, 0.3 seconds, where really it counts. Can you dissociate and move the parts of your body that are required to do in the right sequence to get the face of the club on the ball consistently? All right, and then we can go and work on skill and sport. So what are we going to do? If we found certain defaults or deficits, how do we address them, right? So let's go over a couple of these exercises now. So I'm going to pull this up. Actually, let me pull that back up because it's got my list of things. Real easy. First, I always address people's mobility or lack of range of motion first. So that means thoracic rotation and hip rotation. One of the exercises that I'll do, we call it an open book exercise, right? So when we look at the spine, the thoracic spine is different than the lumbar spine, lower back and mid back. The lower back, like we said, doesn't like rotation. Mid back likes rotation. So to get this stretch into the right segment, we want to make sure that when we position, the lower back is flexed, and that way you lock it up and it prevents it from rotating so that when we do the stretch, we can get it in the right spot. So you're going to be lying on your side and you're going to bring your knees up. So as you bring your knees up, the knees should be higher than the hips, okay? What that does is basically takes the lower back and puts it in that flex position, and that locks up the lower back and prevents it from rotating. We put the bottom hand, this case, since I'm on my left side, my left hand is going to be on my legs and holding those together. Again, just like that thoracic, the torso rotation test, we don't want the knees to move when we do this. The other hand, you can grab the ribs and then pull and rotate to the opposite direction. So I'm rotating to the right, and I can repeatedly do this. The hand position, this is one suggestion. Another suggestion, if you want to support behind the head, you can go ahead and do that and rotate repeatedly. Rotating repeatedly is helping to mobilize the joint of the thoracic spine versus a stretch where we're trying to elongate tissue and make it longer. Static stretching, we hold it for 30 seconds at least. But the key thing is legs do not move and as you rotate. So this is the open book test, open book stretch. You could also unhook the hand and do it this way. But be careful that when you do this, that you don't just end up doing this. You can see how I'm not moving, I'm looking at the camera, and my shoulder's doing all the work. So that, a lot of times when people with limited thoracic rotation, they'll just do this. And then they wind up with shoulder issues, all right? Because again, the tight thoracic spine, your body tries to make that scapula, the shoulder blade, where it's supposed to be stable, into a mobile segment. So you want to try and avoid those compensations. So what I usually program is that we do this open book stretch for about a minute each side, okay? So then we go to the lower half where we try and improve the rotation of your hips. So we lie down on the ground. We need a lot of room for this because as I set my feet with my knees bent, I want my feet to be wider than my hips, okay? I don't want them to be narrow. If we do this movement with the narrow feet, we'll start to move the lower back more than the hips. So we're going to go wide with the feet, and then you're going to lie down, all right? So you're going to keep your ribs still. Hands are going to be on the rib cage, trying to maintain that position and not have it move. Wide feet, knees bent, and then you're going to rotate the knees. Knees go to the left, and then knees go to the right. So this is like the level one, very easy hip drop exercise. To check your points of performance is that if you rotate inward and you look down, the knee, hip, and shoulder should match or be in line when you go either side. Let me show you this way. All right, so we're head on. There we go, move this out of the way. So that if I go wide, here I am, I'm gonna rotate in, and my knee winds up lined up with my hip and my shoulder. I don't want to be here and I rotate and my knee has gone inside of my hip and my shoulder. Does that make sense? So we want to make sure that we go wide enough to get that rotation only from the hips. We can reposition that foot as needed so that we don't get excessive rotation from the lumbar spine. Okay? All right, so let's see what's next. So thoracic, also the other thing that I like to go through is thoracic extension. So a lot of times with their posture, prolonged sitting, or golf posture, when we're in a C posture where we're addressing the ball and the upper back is rounded like that, which can happen with postural changes, the thoracic spine doesn't rotate very well when it's flexed. Just like when we mentioned earlier that if I round out or flex my lower back, it doesn't rotate. But I don't want my upper back to be rotated. I want my upper back to be more extended. So one way to get more extension and also prevent lower back pain is to use a foam roller. All right, so we're going to be sitting down on the floor. The foam roller will go on the lower ribs. It'll be on the rib cage and we'll work our way up. But I like to start on the lower ribs. All right, let me move my hood out of the way so it doesn't get caught. When I put my hands behind my head, I'm going to move my elbows out of the way. So I pull my elbows forward. I pull my shoulder blades forward out of the way, sorry. And then the elbows stay put, and then I go back. And what I'm doing here is I'm locking down using my abdominals to not make anything move on this side of the foam roll. And everything on that side of the foam roll, I'm going to try and rotate or extend backwards. And it's not going to be a lot of motion. If you lock this down, it's not going to be a lot of motion. But I can unlock that and then just go all the way back, and I get that full extension from the lower back. We don't want that. So we want to keep this on and then go back and then kind of seesaw through that segment, right? And then after we're done with that, maybe about 20 or 30 seconds, we're going to roll the foam roller up about 3 inches to get the next segment. So we're going to go back and forth like that, trying to go as far as we can, comfortably keeping the lower half engaged so that this stays locked down and I can mobilize what's up top. Do the same thing and repeat that through the entire thoracic spine. Okay, so the key is to lock this down, not have anything move below, but everything move above the thoracic, the foam roll. Okay, so that's thoracic extension over the foam roller. That's going to help a lot if you're feeling tight in the upper back, you're rounded, you're sitting at work. The more rounded you are, the less you'll be able to rotate through your thoracic spine. All right. Another thing that I like to do with a lot of my golfers is to work on that dissociation. So that pelvic rotation test that we went over, right? So you can kind of take your club, and I love doing this on the driving range or before you tee off, all right? It just basically activates your abdominals and gets that rotation grooved so that you're ready to hit your first ball. So you're basically going to set up in your golf posture, 5-iron posture. I've got my club here, and I'm just going to place my hands on top of it. Now, what I do is I apply a little bit of downward force with my arms. As I push down with my hands here, it should activate my shoulders, maybe activate the abdominals a little bit. The harder I push down, the more the abdominals should turn on. And then we do the test. The test turns into an exercise. So we look at the quality of motion here. Hopefully you can see like the front and then the back and that back mirror. We look at the quality of motion. Can we rotate the lower half of your body, not side bending, like side to side? Can we stay in the middle and keep the core engaged, keep the shoulders still? So it's not a large motion. It just needs to be crisp and stable and only happen in the lower half, right? So that's pelvic rotation. And I like people to go through that just to warm up, even just like a minute, just kind of going back and forth, feeling that, using the abdominals. Because when you're out on the course, basically as you start from the top of your backswing down into your downswing, the ground reaction force, right, from the feet pushing and pulling, the glutes and the knees moving, all of that power needs to be connected to the thoracic spine, arm, hand, and club. And the only way to connect the lower half to the upper half is using those abdominals, using that transverse and external and internal oblique muscles to get that connected and plug that power source from the lower half to the upper half so that you can hit the ball with less effort, basically, using the bigger muscles versus trying to overdo it with the arms and the hands. And that's typically what we see, especially if a golfer comes to see me that has arm, elbow, or shoulder issues. It's usually something that happens early in the kinematic sequence of the golf swing, some type of movement deficit that causes them to overuse the arms, which can lead to repetitive stress injuries. All right? All right. So hopefully all of that is helpful and informative. Let me know if you have any questions here. I'm just going to take a look at the chat room. All right, and I'll give it the 20 or 30-second countdown here before I sign off. All right, so hopefully you enjoyed our session today. All right, well, thank you for joining me today. You could look for this session and many more on the on demand on any of the Better Spaces apps. I'll be back next week, May 7th, Tuesday, and continuing our theme here, we're going to be talking about golf performance, specific strength and conditioning exercises for a powerful swing. All right, it's going to be focusing on enhancing your golf performance through targeted strength and conditioning. We'll discuss more of the key muscles involved in a powerful swing, and the exercises to improve your strength, speed, and power. All right. So this is going to be useful whether you're a weekend warrior or a seasoned golfer. You're going to learn how to optimize your physical fitness to achieve a more controlled, efficient, and powerful golf swing. All right. Any questions, you can email me here at paul@par5pt.com or team@betterspaces.com. Thank you and be well. Bye-bye.